Hello, it's Dr. Minde. Um, I was just discussing the cavernous sinus in the previous lecture, so I'll just go do a quick overview of it. We said it's located on each side of sella tussica and the sphenoid body. So the sella tussica is here and the body of sphenoid below it, and it extends from superior orbital fissure to the apex of petrous temporal bone. From superior orbital fissure here to the apex of petrous temporal. So this is your cavernous sinus. Okay, what are the relations? Medial to it is the pituitary gland and sphenoidal air sinus. Pituitary gland in the sella tussica and sphenoidal air sinus in the body of sphenoid bone. Then superiorly you have the temporal lobe of the brain, which has been removed here. And then laterally you have the trigeminal ganglion, also called the cavum trigeminal. So the ganglion of trigeminal nerve is located here. So it is lateral to cavernous sinus. Then anteriorly you have the superior orbital fissure and its content as well as the optic nerve. The superior orbital fissure is here, so its contents are anterior to this cavernous sinus. What are the contents? Remember, even optic nerve is anterior to this cavernous sinus. So what are the contents of superior orbital fissure? So you have your cranial nerve 3, oculomotor, 4, trochlear, and 6 subducens. They pass through the superior orbital fissure. So they're anterior relations of the cavernous sinus. Then posteriorly, you have the petrous, part of temporal bone. Here, it's posterior to the cavernous sinus. So what are the structures within the cavernous sinus? We have the siphon of the internal carotid artery and the abducens, which is the sixth cranial nerve. And then what are the structures on the lateral wall of the cavernous sinus? You have cranial nerve 3, 4, oculomotor and trochlear, and the first and second division of cranial nerve 5, and that's ophthalmic and maxillary. What are the communications of cavernous sinus? You divide them into two. We have intracranial communications and extracranial communications. The intracranial include superficial middle cerebral vein, okay? You have superficial middle cerebral vein, intercavernous sinuses connecting the two sides. So here are your intercavernous sinus. This is cavernous of this side and of this side. So these blue here are intercavernous sinuses. So you have superficial middle cerebral vein, intercavernous sinuses, sphenoparietal sinus, superior petrosal sinus. Remember, superior petrosal sinus connects the cavernous sinus to the transverse. So when superior petrosal and transverse join, they form the sigmoid sinus. And then inferior petrosal sinus carries blood from cavernous sinus and empties, or rather joins the sigmoid sinus to form the internal jugular vein. So those are the intracranial communications. While the extracranial communications, we have superior and inferior ophthalmic veins, the pterygoid venous plexuses, pharyngeal venous plexus, as well as the facial vein that can also drain into ophthalmic vein and pterygoid plexus and bring blood into the cavernous sinus. So this is what we are saying. From the cavernous sinus, blood can get through the superior petrosal sinus, okay, and superior petrosal usually joins the transverse sinus to form the sigmoid sinus. Then sigmoid sinus is joined by inferior petrosal to form the internal jugular vein. And this inferior petrosal is also carrying blood from the cavernous sinus. So superior petrosal, inferior petrosal, intercavernous sinus, all these are intracranial communications of the cavernous sinus. While the extracranial communications, you have the pharyngeal plexus, pterygoid plexus, ophthalmic vein here, and facial vein. Again, sphenoparietal sinus is an intercranial communication. You can see it there. Superior petrosal sinus there. Inferior petrosal that's joining sigmoid to form internal jugular vein. You can see inferior petrosal here joining sigmoid to form internal jugular vein. Superior petrosal here joins transverse sinus to form the sigmoid sinus. So these are intracranial communications together with the intercavernous sinus. But the extracranial communications, we have superior and inferior ophthalmic veins, and then we also have the pterygoid plexus, pharyngeal plexus, facial veins. Okay, so why do you need to understand these communications of the cavernous sinus? Spread of infection. Infection can spread from the face through facial veins that communicate with ophthalmic veins and take this blood into the cavernous sinus, this infection into the cavernous sinus. So when you have infection in the upper nasal cavities, paranasal sinuses, the forehead, all these can get intracranially through the cavernous sinus. So we have what you call the danger area of the face. So when you draw a triangle from the center here, involving only the upper lips and the nose, that's your danger area of the face. It's a triangle. So cavernous sinus. So if you have an infection in this danger area of the face, it can get into your brain through the cavernous sinus. Okay. And remember, these cavernous sinuses, they drain via the superior and inferior petrosal sinuses. So superior petrosal will join transverse to form sigmoid, and sigmoid will be joined by inferior petrosal to form the internal jugular vein. So infections within the danger area of the face are potentially deadly because they can spread into the brain and the meninges via the cavernous sinus. So you can spread the infection from this danger area involving the nose and the upper lips to the cavernous sinus through the facial vein here and ophthalmic vein that will take it to the cavernous sinus. Then we have what you call cavernous sinus thrombosis. A thrombus is a clot. So when the infection has spread into the cavernous sinus, bacteria will start to culture, and then there'll be stasis, slow movement of blood within the sinus. This slow movement of blood even becomes better for culturing of bacteria. Then we'll have clots that will form, leading to cavernous thrombosis. So what will happen when you have thrombosis? Ophthalmic veins will not be able to drain very well. So instead of blood from the orbits draining, like it cannot drain, then you get what you call exophthalmos. Okay, the eyeball bulges out of the orbit because blood is accumulating behind the eyeball where the cavernous sinus is, and then the conjunctiva become engorged. That's what you call chemosis because they're not able to drain blood. Then we also have compression of the nerves to extraocular muscles. When you have a clot within the cavernous sinus, remember the trochlear nerve is there, the abducens nerve, the oculomotor, you'll get ophthalmoplegia because these extraocular muscles will not be able to move. Then we also have impaired sensation, the area that is supplied by ophthalmic and maxillary. Ophthalmic is to the upper part of the face, the forehead, and maxillary is at the mid-face region. So impaired sensation if there's a thrombus within the cavernous sinus. So these are the three symptoms of cavernous sinus thrombosis. This is what you call exophthalmos. The eyeball is bulging out of the orbit, and you can see chemosis, the red coloration of the conjunctiva because of cavernous sinus thrombosis. So this is what we mean. Your facial veins and ophthalmic veins, they drain like this. So, okay. So you drain blood into the cavernous sinus. So when there is a clot here, blood that usually flows this way, and there's a clot here, there will be slow movement. So blood will not be able to flow. This cavernous sinus becomes engorged, so you tend to that's exophthalmos, and then the conjunctiva is also not able to drain its blood in that direction. So blood accumulates in the conjunctiva, it becomes red, so that's why you have chemosis. So those are the features of cavernous sinus thrombosis. Then we also have arteriovenous fistula. Remember, within the cavernous sinus, we have internal carotid artery. And cavernous sinus itself is carrying venous blood. So we have an artery and a vein. Now, when there's a base of skull fracture, remember this cavernous sinus is within the middle cranial fossa at the base. So in an accident, when there's a base of skull fracture, what happens? The internal carotid artery may tear within the cavernous sinus. So now we are having a mixture of arterial and venous blood. But arterial blood has pulsations, and it's carrying blood at a higher pressure. So blood leaks into the cavernous sinus, arterial blood leaks into the cavernous sinus, it enlarges the sinus, then blood will be forced out from the sinus through the communicating veins. And these veins are going to the eye, for example. So you'll still get exophthalmos and chemosis after skull base fracture because fistula is a communication between the two, arteriovenous fistula. The internal carotid artery has torn, so there's a communication between arterial blood and venous blood. So you get exophthalmos, bulging out of the eyeball, and chemosis, the redness of the conjunctiva. And then because the arterial blood is from the heart, it has pulses, you get what you call pulsatile exophthalmos. The eyeball is bulging and you can see it pulsating, and this pulse is in synchrony with the pulse of the radial artery. Then we have what you call emissary veins. Emissary veins are valveless veins, okay? They usually connect intracranial venous sinuses with extracranial veins. And because they have no valves, the blood will flow in either direction. So that explains why when there's raised intracranial pressure, the veins of the face and the scalp will bulge because the veins from the inner intracranial compartment will now try to communicate and carry the blood into extracranial veins. So they will be bulging. The scalp and the face veins will bulge in raised intracranial pressure. So we name these emissary veins based on where they're located. On the frontal bone, they're the frontal emissary veins. They pass through the foramen cecum and connect with the superior sagittal sinus. Within the parietal bone, we have parietal emissary veins through the parietal foramina. On the mastoid and the condyles of the occipital bone, you have mastoid emissary veins. So these emissary veins provide alternate route of blood when the internal jugular vein is occluded. Remember, all these venous sinuses eventually drain via the internal jugular vein. Okay, so when the internal jugular vein is occluded either by tumor that's compressing it or whatever cause, you are able to drain via an alternative route through these emissary veins. So the alternative can be the vertebral venous plexus or communication with the basilar sinuses. So this is just to show you the emissary veins you have at the parietal region, occipital region, the mastoid region, the frontal region. So that's the position of the emissary veins. And then this is to show you your cavernous sinus. You can see it's communicating with superior and inferior ophthalmic veins. It's also communicating with the pterygoid venous plexuses, communicating with superior and inferior petrosal sinuses. So all these are communications of the cavernous. Appreciate superior sagittal sinus. Inferior sagittal will be joined by great cerebral vein of Galen to form straight sinus. So straight sinus, superior sagittal, and occipital sinus will form the confluence of sinuses. Then the superior sagittal forms the right transverse, the straight sinus forms the left transverse. The transverse and superior petrosal will form the S-shaped sigmoid sinus. The sigmoid plus inferior petrosal together form the internal jugular vein, which basically drains all the venous sinuses. So what's a clinical application of these emissary veins? Emissary veins, because of the communication between intra and extracranial, you're able to pass infection from the outside, maybe the scalp, into the durovenous sinuses. So scalp infection can get into the superior sagittal sinus via parietal emissary veins, for example. Bacterial infection can cause inflammation of the emissary veins. Then you form clots within the emissary veins and the venous sinuses. And these can also affect the cerebrum if it's not able to drain very well in cases of thrombophlebitis of the cortical veins. When there's a thrombus due to infection, there's inflammation of these cortical veins leading to cortical infarction. Okay? Then the next lecture we will discuss the ventricular system. Thank you.